That's pretty good. Yeah.
I don't want to start crying.
That's okay. So I understand you came to see me because you've been having a lot of foot pains and then you've been having some back pains. I know that we kind of discussed a little bit more about it. Can you just kind of elaborate on it, please?
Okay, so my heel has been hurting for the past about 2-3 months.
2-3 months, gotcha.
Yes. I am now starting to feel like pain in the lower back area.
How long now?
For the same time since my foot has started.
2-3 months.
Yes.
Okay. Did you have any other kind of pains in your body?
Just on the right shoulder.
Under your right shoulder, gotcha.
Yeah, but I was being treated for that separately.
When did you get treated?
The last time I got my trigger point was, I think it was November of last year.
Okay. It might be a little strange for me to be able to ask you, but I gotta ask this question.
Yes.
Since you've been getting those shoulder treatments, trigger point injection, which is going to be a steroid, once you start getting it for your shoulder, how was your foot pain after?
I was still feeling foot pain, like
more or less?
More. So that is
Yes.
why I decided not to take it, the trigger point, because something is not right.
Okay.
I really don't know how to explain that part, but something wasn't right.
So I want to be able to tell you something crazy. Everything in your body is related. After I treat your shoulder or under your shoulder areas, I'm going to be asking you, how's your foot pain?
Okay.
It sounds kind of crazy, but I want to be able to make sure that you understand everything in your body is related.
Yeah, I know.
And that actually could be related to your shoulder pains also,
Definitely.
as well as your low back pain. So we're going to take a look at all the things, okay?
Okay.
So where's your foot pain usually?
In around the ankle area.
So
and
right about this
here.
area?
Yes.
And then this area? So from here and here is where your ankle, where your foot pain is.
Yes. I'm just touching it, trust me.
Painful right now?
Just rubbing your hands over it, it feels, oh my goodness. Yeah.
You feel pain right now?
Yeah.
You know, I'm touching you like as if I'm touching baby's bottom, very, very soft.
But
Very, I'm
probably because I'm having too much pain with it, so I'm just scared.
Gotcha. Okay. So this actually is giving you pain right now.
Slight, yeah.
Okay. So from 0 to 10, what's the pain level when I'm actually doing this right on you?
About 6.
6. Just one thing that I have noticed when I'm actually taking a look at you is that your entire leg on your right side is actually smaller. Did you know about that?
What?
Did anybody tell you about that?
No.
So one thing that I want to be able to let you know is that there are muscles that in your leg that are kind of become degenerative, just like the bones.
Like breaking down?
When you have arthritis, you start to lose your bone density, you start to have osteoporosis, things like this, yes?
I have arthritis?
No. I'm not trying to say that. But what I'm trying to tell you is when you have a bone problem, let's say somebody down the street has a bone problems. When they have a bone problem, they start to have they start to lose bone density since they start to have osteoporosis, they start to have arthritis in the joints. That's exactly what happens.
Okay.
When there is a muscle problem, you don't have such like mechanics for that. So what they do is that they start to lose muscle mass. The muscle becomes more flaccid, does not become as responsive. The tones of muscle changes.
Okay.
That actually tells me there has been prolonged amount of stance of the injuries or muscle injuries, muscle problems that have been persisting. Does it make sense to you?
Yes.
It's actually 15.5. You see that, right?
Yeah.
The moment of truth. What does it say? 14.5.
What?
Yeah. So that means that you have lost 1 inch of muscles. That's not a small feat. This much of muscle mass you have lost.
That's a lot.
That's a lot. Of course it's a lot.
Yes.
So that means that there are some kind of a nerve supply that is kind of interrupted for a very long time. This kind of thing does not happen in 2 months. This is usually much longer. I just wanted to kind of bring it to your attention.
Yeah.
A lot of times foot doctors look at this, oh man, she got a problem in X, Y, and Z regions of the foot, and then they usually where to stop. If you just kind of take a couple steps back and then see exactly what the entire problems are here, your entire foot, not only your foot, but your calf muscle, your thigh muscle, everything on this side is weak.
On the right.
So what that tells me is there's some kind of problems that are going on that is actually above your thigh, which is your pelvic area and your low back. So that's probably what's causing this.
Yeah.
Having said that, you said that you've been having a problem for 2 to 3 months. That kind of muscle degeneration, muscle problem does not happen in 2 to 3 months. This I'm at least looking into at least 10 to 15 years. There's a 10 to 15 years of problem that has not been undetected and then not been corrected. Okay, so I'm going to go ahead and examine your low back and your spine. The reason being is because I detected your problems to be going as high as this regions. Your weakness is all the things right above your weak thighs, actually this region right, your pelvis and your low back. So just by looking at it, just by me not doing anything, I want to be able to let you know this muscle is right here. You see how thick and how tight, how constricted this actually feels like. You see how constricted, how tight this actually feels like. That tells me what? That tells me that there's some kind of a structural instability that is causing it. Just like when there's some kind of instability that is caused, you want to be able to grab it tighter. That's exactly actually what it feels like. A lot of people say, oh, that's why it's low back supposed to be like. No. There's some kind of problem that actually causes right here. And then just me looking at your things over here, this is where your shoulder pain, right?
Yes.
I'm actually seeing a lot of swellings and a lot of edemas around this area.
What?
Yes. A lot of swellings and a lot of edemas. I might be able to make your shoulders to feel better. So before I go any further, let me just kind of do a little test. I know that I'm here to fix your foot pain and foremost foot pain, but it'll be nice if I can fix your shoulders at the same time. So why don't you go ahead and then raise up this left arm. I know left arm is not so bad for you. Go ahead and then bring it down, and then go ahead and then bring it side to side, and then bring it all the way up. Yeah, as much as you can. Perfect. Okay, push it down. Good. So that's a normal shoulder. Let me see you doing with the right side. Oh, without moving your shoulders.
I don't think it's gonna move very far.
Oh, it's okay. It's okay. I want to be able to see if we can do before and after. That's all I want to do.
It's not gonna go far.
It's okay. Okay, try more. So as I'm doing it, I see that you are unable to reincorporate any kind of muscles and bones right here. So that's the reason you are not able to take all the things. Go ahead and push it down. You remember that I asked you to bring your shoulder up all the way here like this? Try to bring it up.
Up like this?
Yes, as much as possible. Without moving your...
It's not gonna go up if I don't do that.
Okay.
Like this.
You can, okay.
Mm-hmm.
Just found something right here.
Yep, definitely. I know.
You already feel it, right?
I know. Yes, yes. Right here is the problem area.
Another problem right here. So, this is your foot x-rays right here. This is your foot x-ray. R means right.
Yeah.
Now R is like pirate R, but I'm just
okay.
R means the for the right foot. It's fine.
It is?
Yeah, it's okay. You have a pain right here. That's exactly where you have your pain. Right in from the ankle bones and right in from the bronchial tail. It's fine.
My foot?
You're fine. Your foot is fine.
Oh, so why is it doing me this?
Because of the back.
Oh Jesus.
That's exactly what the reason I'm trying to tell you. This is not your foot problem. This is your back problem. Sure, there's some misalignment here that I can actually make it feel better, but what I'm trying to tell you is your foot is not, you're not having this excruciating pain right here because of your foot. It's extension of your back. Your back is literally crying for help, and then the medium or the channels or the the venues that your low back is using to let you know that there's something going on with your body is through your foot. It does not mean that you have foot pain. This is the reason why I'm once again letting you know. You don't just look at foot, only the foot for the foot pain. You have to look at the entire thing. Does it make sense to you?
Yes, it does.
This is you looking from front to back, okay? This is you looking from side to side.
Yeah.
This is your skull, as you can see. This is your spine, and this is your lower back area. You were not able to raise your shoulder up, and then all the motions was not going through from this area, from your mid back. This was when it was started. So one thing that I'll definitely be able to tell, once I give you the treatments, you'll be able to see, before I even do anything to your shoulder, you'll be able to see what the differences are. To your shoulder and also to your feet.
Okay.
Does it make sense to you?
Yes, it does.
That feels nice. Woo!
Yeah, like
it down. There we go. Did you hear that?
Yeah.
Not done. Breathe out. Let it down. Let it down. There we go. Okay, that's it. I did take your mid backbone where it was giving you the shoulder pain.
Right.
Now I'm going to go ahead and walk around and see how that your foot pain has been like. Like I said, your foot pain and then your shoulders and everything is related. So, how's your foot pain?
Oh gosh, brand new, brand new.
Tell me about the foot pain.
I barely feel anything.
Out of curiosity.
Barely feel anything, honestly.
You don't feel anything, right?
Nope.
Look at me, please. Look at me. Move your right shoulder up. I didn't touch anything on your shoulder, right?
You see that?
I'm getting chills in my spine too. That's pretty good. Yeah.
I don't want to start crying.
That's okay. Are you happy?
Yes, very.
Okay. Do you remember going up here like this? Try that.
This?
Yes.
See that?
Yeah.
And I didn't have to do this.
Yes.
Oh my goodness.
Are you okay? Don't cry.